Implementation of the National Health Insurance, or NHI. It also wants government to find ways of increasing funding for its successful implementation. The party is celebrating its 97th birthday, and our reporter Plesa Moeti filed this report for us.
We are at the Plesa Hospital here in Bloemfontein. This is where members of the SACP have marched to pledge their support for the National Health Insurance. They've handed over a memorandum to the hospital management just a few minutes ago. But joining us right now is the SACP's first Deputy General Secretary, Ntate Solima Paila, just to give us more detail about particularly this three-day program that they embarked upon as the SACP in celebration of their 97th birthday here in the Free State. Ntate Mapaila, thank you very much for your time, sir.
Thank you.
Let's just start with the National Health Insurance and your position as the SACP. What is your take on it? You're supposed to be, or rather you've indicated that you're very much supportive and you want this to be implemented as quickly as possible.
Yes, this is a long overdue program that we campaigned for in public as the SACP when we launched our Red October campaign on public health. Over the years, then the ANC adopted it at its Polokwane conference in 2007, which encouraged us, but it took long for implementation. That's why we can't wait for it to be implemented. We've been worried by the forces of capital that decided to fight against introduction of the National Health Insurance. That's why we are here to pledge our support to government, particularly to Dr. Aaron Motsoaledi, who's leading this program with good leadership, to ensure that this program is implemented across the country for universal health coverage of our people, and to make sure that the skewed public resources that have been used between the private sector and the public sector should actually be consolidated into a single public administered fund for the health of our country. As we speak today, the two hospitals that are joining each other, the Plesa Hospital and the Plesa Net Care Hospital, are both subsidized by government, and the other one, the private one, gets more support than the public sector one, on the basis that nationally government spends 8-point-something billion rands, 8-point-something% of its budget on health, but 4.1 of those goes to the public sector, 4.5 plus goes to the private sector, which is a huge disparity. And the private sector only caters for about 16% of the population, whereas the public sector caters the remaining 84%, the majority of the 84%. All of that is single public money. And it's because of that there's been huge disparities between the private and the public sector. That is why this program is much more critical for us. We have already established a front for the introduction of the National Health Insurance across the board through the seminar that we held to discuss the key areas, critical areas for the rollout of the program. As we are happy that our province managed to coordinate this particular program from the Free State, where we are starting to roll out this campaign in support of the introduction of the National Health Insurance.
Now, you've also spoken about this Buthelezi ambulance service, that you feel that it should be done away with. Just talk to us a little bit about that.
The Buthelezi ambulances are part and parcel of the outsourced health services. For instance, in this case, for ambulances that have been providing services in the Free State province as well as in the Northwest province. In both two areas, there have been serious problems with regard to their contracts, but overall is the fact that such a critical aspect of health service cannot be left in the hands of the private sector, who are not accountable, who in many instances they don't pitch up, particularly in difficult areas, to pick up our people. We were in Jagersfontein, for instance. When we were in that particular program, we arrived and found that our people, majority of them have complained that pregnant women in the farms find it difficult to be transported by these ambulance services because they find it too far and too difficult to go, whereas a public health care system will not matter where you are. So that is why we also feel that this particularly contract was actually engulfed in corporate capture of the health system, that is of the public sector system, by private corporates through a tendering process that favors one particular particular grouping over others, but that's not much about whether they are particular groupings. It's the role of the public sector in the provision of critical healthcare services like the ambulances, which should not be owned by private companies.
Yesterday you went for Risberg, where you got to interact with the community, and you mentioned earlier in your address that issues of corruption were also raised, and also you've spoken about the role of the police in there. Just talk to us a little bit about that.
Yes, we've made a commitment that we'll talk to the national leadership of the police, in particular Minister Bekitele, to express the views that we have received in the 3 districts, which are quite, which would not have been possible for someone to coordinate them. The fact that the police are unable to assist people when they report cases against corruption in the province. They reject that, they send them from pillar to post, and some were very credible people that came to us to say this is what they've done, and they still don't get any joy. One of them is a traditional leader who we really felt that was also ill-treated in the manner that they approach the question of the fight against corruption. So we now want to make a call that actually what we think might be needed, given some of the reports of corruption that we received from the public meetings, is the fact that we have had people who came to us and said, here is a project that was supposed to be implemented in this particular area. We are told that government has spent so much money, but the project has not yet been implemented. We think there might be a necessity for a special investigation to find to do an inspection in loco of various government projects that money has been paid and people have said they've not been services for the said particular program, so that accountability can reign and we can then get those people who say they've implemented this program or where the money has gone to, and those people that have not finally accounted for those kind of programs. So we have picked up that corruption is a big issue, and we want to call on the police to work with communities to help them to fight the scourge of corruption, and necessarily not to meddle in politics and be part and parcel of the corruption networks that then refuses people to come and report cases against corruption. So these are some of the reports that were given to us, particularly issues in the rural land and rural development sector regarding the CPAs. We have had so many cases about the CPAs. That means there's been too much corruption there. Of course, we have made a commitment that after this program, we'll make a full report to the relevant ministries and the departments for their direct intervention.
That is the first Deputy General Secretary of the SACP, Ntate Solima Paila, wrapping up celebrations of the SACP's 97th birthday here in the Free State.